Introducing the Proxisure suturing device from Ethicon. The Proxisure suturing device is a reusable instrument with a limited life. The working length of the device is 40 centimeters, and it fits through a 12mm trocar. It comes packaged non-sterile and must be cleaned and sterilized prior to use per the sterilization instructions. The single patient use suture cartridges listed here are sold separately and are exclusive to Proxisure suturing device. Each suture cartridge contains a 5/8 curved taper point needle attached to 48 inches, 122 centimeters of suture. The needle length is 21 millimeters. The Proxisure suturing device, Ethibond polyester suture cartridge, and coated Vicryl polyglactin 910 suture cartridge are indicated for suturing in minimally invasive surgeries and designed for the placement of interrupted or running stitches in soft tissue. Loading a Proxisure suture cartridge. Using sterile technique, remove the Proxisure suture cartridge from the package. It is recommended to only load a suture cartridge that is in a suture cartridge tray to prevent inadvertent needle sticks. Prior to loading the suture cartridge, ensure the jaws are parallel to one another. Use the articulation and rotation knobs to ensure the shaft and distal tip are in a neutral position prior to loading the suture cartridge. Ensure that the trigger is not in a partially squeezed position to prevent misloading a suture cartridge. Visualize and note the parallel jaw position. The upper stationary jaw must be above the lower pivoting jaw, and green cartridge release lever on the bottom. Align the arrow on the suture cartridge tray lid with the instrument jaws. Insert the suture cartridge into the instrument until you hear a click and the suture cartridge is secured in the device jaws. Do not use excessive force to load the suture cartridge into the device jaws. Gently pull the suture out and cut the suture to desired length, if necessary. The scale on the shaft of the instrument can be used as a reference. Discard the empty suture cartridge tray in an appropriate container. Test functionality of the device. To ensure the device was properly prepared during sterilization, the device should be received with the flush port in the open position. Prior to each use, test the functionality of the instrument to ensure that the device has not reached the end of its useful life. Use the rotation and articulation knobs to test that the device can articulate 45 degrees in both directions and rotate 360 degrees in both directions without excessive force. To test the needle rotation, load a new suture cartridge. Hold the suture upward and away from the needle track with minimal tension to prevent suture entanglement and potential suture damage. Applying too much tension on the suture during cycling will inhibit movement of the needle. Fully squeeze the trigger until it touches the handle once to rotate 180 degrees, then a second time to complete the 360-degree cycle. If the trigger is partially squeezed, the trigger will remain in the partially squeezed position. To return the trigger to its original position, fully squeeze the trigger until it touches the handle. Be aware the needle exits from the green side of the cartridge. If the needle does not rotate freely or return to the home position, repeat the test. If after testing the suture cartridge a second time and the needle is still not rotating properly, replace the suture cartridge and repeat testing. If testing with the second suture cartridge fails, the Proxisure suturing device may be damaged or beyond its useful life and should be replaced. Prior to use, close the flush port of the device with the lure cap to prevent air leakage and loss of insufflation during the procedure. The instrument is now ready for use. Suturing instructions for use. When inserting the instrument into the trocar, ensure the instrument is straight and not articulated. Insert through a 12mm trocar until the articulation joint on the instrument is visible past the tip of the trocar cannula. Avoid inadvertently squeezing the trigger, as this may result in unintended needle tip exposure. Place the green side of the cartridge on the target tissue. The curved needle will exit from the green side of the cartridge. Articulate and rotate the distal tip if necessary to achieve the desired angle and placement. Squeeze the trigger 2 times for complete 360-degree rotation of the curved needle to smoothly pass the curved needle through the tissue. After the second squeeze of the trigger, the curved needle is reset and ready for the next action. Gently pull the device away from the tissue. To verify the needle and suture have completely cycled through the tissue, the suture should be visible between the distal tip and the tissue. Tie a knot using your preferred knotting technique. As you continue to throw additional stitches, maintain the suture tension in the opposite direction of the continuous suture line. This will prevent the suture from getting locked. Avoid suturing through an obstruction, such as clips, stents, and guide wires with the Proxisure suturing device. It may result in an incomplete suture pass, damage to the needle, or needle and suture entanglement. Instrument removal from trocar. Articulate the distal tip of the instrument to ensure it is in the straight position and jaws are parallel, and then remove the instrument from the trocar. Do not allow fluids to dry on the cartridge. Dried fluids may prevent the needle from cycling completely through the tissue. Suture cartridge unloading. Move the green suture cartridge release lever back toward the handle to open the jaws and release the used suture cartridge. To prevent a needle stick while removing the suture cartridge, visually ensure the needle is not exposed. Allow the suture cartridge to fall out after opening the jaws. If the suture cartridge does not immediately release from the instrument, hold the suture to gently pull the suture cartridge out, or hold the sides of suture cartridge with index finger and thumb. Account for used needles per hospital protocol. Dispose of the used suture cartridge in a sharps container. Point of use cleaning during procedure. If the instrument will be reloaded with another suture cartridge, rinse the instrument in sterile water, then follow the steps to load a new cartridge. Pre-treat. Preparation for cleaning and sterilization in the operating room. Clean the instrument as soon as possible after use to prevent the formation of biofilm and dried-on residue. This step is critical to prepare the device for cleaning and sterilization and will assist with the cleaning process. Ensure the suture cartridge has been removed from the instrument. If cleaning must be delayed, wet the instrument in tap or purified water to prevent drying and incrustation of soil. Remove excessive solids using disposable wipes, enzymatic foam spray, or per hospital procedure. Immerse the entire instrument in tap or purified water. Do not use saline water for cleaning to minimize the chance of corrosion. Follow the instructions for cleaning and autoclave sterilization. While enabling improved OR efficiency and a reduction in OR cost, Proxisure is designed to precisely suture and knot tie in tight spaces. To learn more about Proxisure, contact your local Ethicon representative.